medication administration records, or MARs, or what we all know now as EMARs, because as of 2017 they changed the regulations that all facilities were to go to an EMAR system, and then are regulated to have at least a battery backup or generator backup system for at least one computer, that no matter what, you have access to print MARs if there was ever an energy failure. So I don't spend a lot of time on talking about paper MARs, but at the same time, just for whatever situation, if you do end up that you have to use one, the apocalypse is coming, they take all the electric cells out of the universe, and we can't use those backup generators and battery packs. I don't know, we're going to learn about it anyway. So here we go. So on a paper MAR, you always want to make sure you at least have those two identifiers for a patient on them. So at least name and date of birth. One thing that I always recommend that should always be on there too is their known allergies, right? Because again, if you're putting a new medication on here and there's this specifically a medication that they might be allergic to, you want to be able to check that before you're putting a new order on that. So a lot of times they're going to have room for name and a lot of demographic information at the bottom. Again, everywhere is going to be different on what they want you to put on there, but again, name and date of birth and allergy should be a minimum. Everyone could potentially look different too. These are ones that your order and the medication names and all the direction are going to go in this box here. And basically when you're transcribing that, you're taking it directly from the order signed by the doctor, not the medication label, not the medication label, not the medication label. You're going to use the order from the doctor that the medication was ordered from, and you're going to transcribe that order onto here. Now you do want to check that to the bottle and make sure they match and make sure that it's going, but you always want to make sure you're transcribing from the actual order, not from the medication bottle. And then there's always going to be a room for putting what time or when you're going to administer the medication. So again, that can be different depending on where you are, what scenario you are in. Some places may do specific times. Maybe it's 9 a.m. and 9 p.m. Maybe it says a.m. and p.m. Maybe it says morning and afternoon. Maybe it says breakfast and dinner. Everywhere is going to be different, so it's again knowing what is applicable to you and your scenario, but again knowing that every situation can be different. So when they are in those situations, if it's time specific, if it says 9 a.m., that means you can give it as early as 8:30 and as late as 9:30. So you have a half-hour window on each side of a specific time. If it is a timed window, like morning or AM, where maybe in your facility AM means from 9 to 11 a.m., that's the window that you have to give it. That is the window. The half hour extra on each end does not apply to a window. The half hour only applies to a specific time that it is scheduled to be given. So again, if there's a window, just make sure you know the window of your facility. Sometimes, you know, you have early morning, which is like 6 to 9, and then you have late morning that is 9 to 11 or 9 to 1, so you can cover lunch. Again, depending on your facility and your residents' or patients' needs is usually the way it's set up. And then on a paper MAR, there's going to be a box for every day to put your initials for when you're administering that. If it's something that's maybe only administered once a week, you want to make sure that you're crossing out and putting a line through the days that you're not going to be administering it. And a lot of times you like outline the box where the days that you are going to be giving it. And you always want to make sure too that if a medication is discontinued, that again you're putting a line through the rest of the month, and a lot of times you'll use a yellow highlighter to highlight that box out, showing that it's no longer in use or that you're not giving it. And the reason that you use yellow, you should never use any other color highlighter on any medical documentation, because if you're doing a photocopy or you're scanning or faxing something, the yellow doesn't show up. So therefore it doesn't, like if you had something yellowed out, it wouldn't black that out. If you were scanning it, you'd still be able to see it on the scan, if that makes sense for a fax. The other thing to remember about a paper MAR is that if you are giving a PRN or as needed medication, or you're maybe documenting that somebody has refused a medication, that's usually done on the back. And so there's usually a place where you fill out the medication, the reason, maybe it was the PRN, so you want to then go back to and have that follow-up of the result. If somebody asks you for Tylenol for a headache, maybe an hour or two later, you want to make sure that you go back. You want to see if that resolve their headache, and if it did, you want to document that. If it didn't, you want to document that too, and maybe that's where, again, advocating for your patient, you're going to be like, man, they have a really bad headache, maybe I should call their daughter, maybe I should call my supervisor, again, whatever that next step is for you in your scenario where you're working, again, to be advocating for your patients or your residents. So with that, always make sure you're using blue or black ink, and you, again, want to write legibly on these. And again, on paper Mars, there's usually always a signature block that anybody that is using them or putting their initials, that it has room for you to print out your name to match it to the initials that you're going to be using. Because some people's initials may be CB, but it looks like an O and a P. Who knows? But that's where you have the opportunity to write it the way you're going to write it. If you want to put a smiley face for all of yours, you can, but it has to match down here to your signature block, if that makes sense. You can put a little lightning bolt sign if that's what you want your sign to be here, but it has to match here in saying that's what I'm going to use to acknowledge my signature of the medication administration, if that makes sense. Again, you always want to make sure that these match your orders. When you're using an EMAR, obviously it's a little bit different. Usually there's somebody putting those in for you. Again, every scenario has a different protocol of who's putting the orders on, who's transcribing, who's starting some of those things. But in your EMAR, again, you want to make sure that you're checking that to the actual order and checking it to the label of the medication that you're getting, making sure that they're all matching. And again, it's always good to know, especially for night shift, those type of things that, say hospice comes in the middle of the night and, Miss Mary needs to start taking morphine, or maybe we need to increase her morphine orders and she's going to take it every 4 hours instead of every 6 hours, or maybe it's a little bit more than what she was taking, and we're going to give you a new order. Well, guess what? In the middle of the night, you need to know what you need to do with that order so that you can start giving Mary her medication and not wait for 12 hours until somebody comes in. So what are those steps? What do you do when you get a new order to make sure that you're implementing the new medications, or maybe they want to stop a medication? If you get an order to stop a medication, typically you want to have that stopped before the next dose. But again, that's where you need to know your protocol and understand how you're going to implement that change in a medication order. Also, on medication orders, they should all have an indication of use. That means that if it is Tylenol and it says take 650 milligrams of Tylenol every 4 hours for a headache, you cannot give that Tylenol to a patient for a fever. They have to have a separate order for the Tylenol to take it for a fever. Now it can be used maybe from the same package or from the same bottle of Tylenol, but you need to make sure that there's the indication of use that matches it for what you're using it for. So if it's metoprolol, which is a blood pressure medication, it's going to say take however many milligrams, blah, 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 for high blood pressure or low blood pressure or whatever that is for. That is the indication of use. And you want to make sure that that is always on the orders, and it is also always transcribed to the EMAR or the MAR.